Hello and welcome to the RCNi Nurse Awards 2020, delivered on behalf of the RCN to showcase the clinical expertise, commitment and compassion demonstrated by nurses throughout the UK. This year is extra special as we are celebrating what nurses do for people from all walks of life and at every stage of life worldwide throughout the International Year of the Nurse and Midwife. But at the beginning of the year, who would have predicted how nursing would need to demonstrate its value globally through its committed professional response to the pandemic? So before we meet our 2020 finalists, let's hear from some of our Nurse Award winners and finalists about how they are meeting the challenge of COVID-19.
It's very difficult to talk about the positives when you think of COVID, when you think of what you've been through. I don't think any of us could have comprehended the level of stock we would need in a month. We would get emails from suppliers saying all stocks were being diverted to the NHS. It was almost like we were forgotten.
We were all just very frightened about what it meant and what it would mean for our working patterns and bringing it home and passing it on to loved ones, protecting ourselves. The challenges were looking at the best way to facilitate end-of-life care that was dignified and met the needs of the department as well as the needs of the patient.
We've had people come to us that believe that they have found the cure for COVID, that drinking bleach would cure COVID. We've had people present to us who were redeployed from one area of healthcare and kind of straight into an area that they were unfamiliar with, without preparation, without support, and they have been traumatised by what they've seen.
It changed everything about our way of working. It just completely turned it on its head.
We did lose staff across our footprint during COVID. So we created a flag to go over the condolence trolley. We've had all staff playing a guard of honour as the staff are being taken to the mortuary. So although it's been really, really tough, we need to show, we really, really do care.
What supported us are the families. They've sent videos, they've done fun things, they've sent care packages. It's helped us look at things in a different way, particularly with technology. We've done staff clinics, we do family clinics, and kindness has really been evident across all of our care homes. Kindness from staff, commitment from staff, but kindness from the community and families as well.
Our patient feedback that we got was amazing. The patients loved being cared for by us. People came all together and it created such a lovely atmosphere. There was like a sense of unity for that we wanted to fight the pandemic.
When a hotel place came up for somebody, we were able to visit them on the street. We could symptom screen them, stabilise their drug use as well in lots of cases. Yeah, we saw real improvements in health, which were amazing.
We take handprints and lip kisses and photographs of tattoos. That's what we do. Free compassionate work beyond anybody's expectation.
What a remarkable response from the nursing profession to an unprecedented challenge. Now it's time to celebrate what nurses deliver for individuals, families and entire communities day in, day out. So let's meet our finalist in the Learning Disability Nursing category of the RCNi Nurse Awards 2020.
Our first finalist is the East Cheshire Community Learning Disability Health Team, led by Stacey Bagley. It has transformed the care and support of people with Down syndrome or a learning disability who also have dementia, including developing a specialised clinic. Next are HMP Parc's learning disability nurses. They've made huge improvements to the prison experience of people with learning disabilities and autism spectrum conditions by developing the UK's first specialist wing with fantastic results both in prison and on release. Our next finalist is Jennifer Hudson. She delivers relationship and sex education sessions to adults with learning disabilities, which helps them make safe choices in their relationships and safeguards them against abuse. The sessions have also improved screening rates. Michael Fullerton is our fourth finalist. He has developed benchmarks setting out what good support looks like for adults and children with profound and multiple learning disabilities. The standards are being adopted by a range of organisations. Thinking outside the box, the Tower Hamlets Community Learning Disability Service helped its clients lose weight by the kilos, using pooled personal budgets to fund a specially adapted program at a fitness centre, combined with dietary advice sessions. 5 great finalists, but there can only be one winner. And it's the Healthcare Parc Prison team. The judges thought it was a wonderful example of teamwork, with the nurses working together on many fronts to improve the life and opportunities of the people they supported.
Congratulations to the Healthcare Parc Prison team. Your unique service shows the huge scope and enormous impact of learning disability nurse practice. A worthy winner in the International Year of the Nurse and Midwife. The awards recognise the very best of nursing, and you can find the winners of all our categories at rcni.com/nurse-awards. Thank you for being a part of this celebration. Before you leave, please take a moment to remember the members of the nursing team who have died during the pandemic.